Hello everyone, today we are going to talk about SBRT. I'm going to try to explain to you SBRT. I know many of you think it's a simple concept, but trust me, it's not. Before starting this video, I would like to thank all of you for liking, for viewing, and for commenting, and of course for subscribing to this channel. We are already 20 and that's amazing. If you are not subscribed yet and you are interested in radiation oncology, don't forget to hit the subscribe button. If I ask you what SBRT is, most of you will answer me. It's a radiotherapy technique in which high dose per fraction is used in a few fractions for extracranial tumors. And yes, that's true, but it's only part of the story. Okay, I'm gonna break something right away. There is no real definition for SBRT. It's true, SBRT still lacks a strict definition. However, it's part of a broader family of stereotactic techniques, which includes SRS and FSRT for stereotactic radiosurgery and fractionated stereotactic radiotherapy. These are primarily used for intracranial treatment, so SRS is in one single fraction and FSRT is for multiple few fractions, whereas SBRT applies the same principles but for extracranial tumors. So even though there's no strict universal definition for SBRT, there have been several attempts to describe it. One interesting example comes from this article, this consensus statement, which gives a structured definition of what SBRT should include. Okay, first, this is a radiotherapy technique using percutaneous beam, so it's external, not internal, like brachytherapy, and that's important because here too, so in brachytherapy, you are also delivering very high dose per fraction. Second, the target is clearly defined. There is no diffuse infiltration like in other settings, just a small volume with potential microscopic spread around it. SBRT is delivered with extremely high precision, including patient immobilization with dedicated devices, accurate imaging of the tumor. If you treat, for example, a liver, you will need an MRI, and of course, an accurate imaging for nearby organ at risks. Conformal planning, IGRT, image guidance radiotherapy, motion management for moving targets, for example, in the lungs or in the liver, and dedicated QA to make sure everything is spot on. In this article, they mentioned that SBRT is when you deliver a biologically high radiation dose, at least equivalent to what we deliver in conventional radiotherapy. But what does this mean? How many grays does this mean? So if you compare on the left the conventional one and on the right, I've taken a specific example to show that it's not that easy to understand what does this mean, what does a high radiation dose means. On the left, you have the lung cancer treated with chemoradiotherapy, and you can see that the BED of this treatment is around 80 gray. And for the bone SBRT in the oligometastatic setting, you can use more dose than that, but sometimes you can use 30 gray in 3 fractions. Sometimes you can use 35 grays in 5 fractions. It really depends. And this, so the 30 gray in 3 fractions leads to a 60 gray BED. So this is less than the conventional ones, but you will still consider this as an SBRT. SBRT is delivered in one single or few fractions, but what is few fractions? Is it less than 5 fractions? Is it less than 10 fractions? We don't have a clear definition yet. The intent of SBRT is usually curative. That's how it was originally defined, but In practice, that it's not always the case. Some studies have also studied SBRT in palliative setting to, for instance, to control symptoms or to delay systemic progression. So when you take all of this into account, the difference between SBRT and conventional radiotherapy becomes quite blurry. In the end, it mainly comes down to the number of fractions, but be careful, even in breast radiotherapy, for example, we now treat just in 5 fractions with the fast forward schedule, so the line isn't always that clear. You could also argue about precision, but conventional radiotherapy is already very precise with immobilization masks and daily image guidance radiotherapy. Here we are giving very high doses in only a few fractions, so there is absolutely no room for error. The precision required in SBRT is on a completely different level. Because if we miss a target, even by a few millimeters, that huge dose can end up in an organ at risk, and that can have serious consequences. What does higher precision really mean? Let's take this example. Here you are treating an L4 oligometastasis. You prescribe 5 times 7 gray and your intent is curative. On paper it looks like SBRT, but if you don't use dye collimation, a fine calculation grid, a proper dose algorithm, a sharp dose fall-off, and a dedicated QA, then it's not SBRT. Because precision in SBRT isn't just about the dose, it's about everything behind the scenes, the physics, the planning, the QA, all those invisible steps that make a true stereotactic technique. SBRT means high doses, few fractions, and precision, but precision is often forgotten, even though it's an essential part of the concept. And remember, there is still no clear definition of SBRT. Precision in SBRT isn't just about one thing, it's everywhere. In the patient setup, motion control, beam shaping, dose calculation, QA, every detail matters, and honestly, this list is non-exhaustive. Another big difference with SBRT is the way we prescribe the dose. It's usually prescribed to the D95 and the dose distribution is intentionally inhomogeneous. The hottest part can go up to 150% inside the target. There is still a lot of debate about using the linear quadratic model at such high doses per fraction. It probably overestimates the biologic effect, more cell kill than it really happens, but even then, late responding tissues are highly sensitive with low alpha beta ratio, so any small error can cause severe toxicity. That's why precision in SBRT is absolutely critical. Take home messages: there is no official definition of SBRT. Delivering high doses per fraction in a few fractions is not enough to define SBRT. SBRT is also characterized by high precision, high accuracy. Thanks for watching, everyone. If you enjoyed the video, don't forget to like, subscribe, and see you in the next one. Bye.